All right. So in this lecture, we're going to be talking about healthism. So um, for this week, excuse me, we're supposed to be going over healthism and sizeism. So with healthism, that is consider that the umbrella, and sizeism comes underneath. So I'll talk about healthism first, and then I'll transition over into sizeism. So here I've provided a little case vignette, and I'm not going to spend too much time on it, but I'm going to give a couple minutes for you to look at it and make note of your feelings. Okay. What about this one? All right. So looking at each of these cases, um, what's the similarity? Well, if you guessed, um, doctor's paternalistic advice. So when we think about healthism, for example, let me go back to this vignette here. When we think about healthism, right, this is the privileging of health as a moral responsibility, and it's typically perpetuated within the medical field by medical physicians, medical doctors. So when we get to the medicalization part, it's going to make a little bit more sense. So hold on to your thoughts about this as we continue on. So before we get started, we have to think about what constitutes health. Health can mean health is different to different people, and health is going to look different for different people. And that's something really important to remember. When we think about health, health is how we understand health. To some extent, it is informed by science. And also, we have to recognize that not everybody is going to be the same, especially when it comes to their size, to their health. We also have to consider genetics, genetic factors, and social cultural factors as well. Now, I want to be clear, there's nothing wrong with having a healthy lifestyle. If, in fact, I promote a healthier lifestyle when possible, when it's possible, when it can be possibly afforded. So I would argue eating more fruits, exercise, drinking more water, eating well, walking more, meditations. There's nothing wrong with incorporating that into your lifestyle. However, it becomes a concern when that is privileged, and it is privileged over everything else. And a person who does not engage in these activities are seen as irresponsible, immoral. In essence, when we think about healthism, it's an excessive attention to one's own health, and this generalizes to other people. And when we look at that as a whole, it's that belief that everybody should strive for a healthy body as a moral obligation, not for the sake of themselves, not for their well-being, but because it's the right thing to do. So who practices it? From what we've seen, it's typically young, middle-aged, and from college-educated, semi-professional backgrounds. These folks who practice it are more likely to be vocal and articulate. Um, and even further, there's the tendency to be enthusiastic about seeking out information about health and illness. A person who also practices healthism, they make positive lifestyle choices. And once again, there's nothing wrong with choosing a healthy lifestyle. Nothing wrong with that. I think it's important to make note that um, not everybody can achieve that lifestyle. Um, and with those who practice healthism, it's not only are these choices made, they're a person moves for everybody to acknowledge the choices that they made. More likely to consume food supplements, concerned about unnatural substances, any fear of small, unseen, insidious threats, and associate science and medicine with danger rather than safety. So, with these last three ones, there have been a lot of concern within recent years um, about chemical substances, um, chemicals in food, chemicals in water, and then also concerns with vaccines. Now, I do want to be clear. Um, Substantial research has documented the safety of vaccines. In anything, there's a scientific consensus that vaccines are safe. Um, and I will also say it, and granted, it has been years since this particular report. Vaccines do not cause autism, nor do they cause any other psychological disorder. Um, or any physical disorder at that. Granted, there might be some physiological reactions, and that's once again when those cases are made known. That's a small probability of it occurring within a larger part of the community. So, and we also have to consider genetic factors, right? But overall, with vaccines, they have been demonstrated to be safe. Um, when we think about uh, GMOs, right? Genetically um, genetically modified foods, so forth and so on. People have raised concerns about what that does to your body. Now, granted, there is some research around the health, around the safety of GMOs, and from what we have seen, or uh, from what's been promoted, what's been understood about GMOs is that they are generally safe. The concern is whenever they're in the wild and they kill other plants. So, granted, and I'll be very clear, there's nothing wrong with choosing foods that are non-GMO. It's your personal choice. It's when that choice is extended to other people and that expectation is extended to other people is where it becomes a concern. So we talked about who practices it. Now we have to talk about where does it come from. So some of this might overlap into history with ableism, just for your information. So remember when we talked about ableism, within the 20th century, there was the rise of scientific advances within medical practices. Well, this is something very much similar, not even similar, it was the same thing. So when you had these rises in health technologies, you started seeing more medicalization into everyday life. And these included the lifestyle choices folks made. So what to eat, what kind of exercise to engage in, okay? So this was even perpetuated further by these different mission statements of various healthcare organizations, professional bodies who made this emphasis on the strive for health, the strive for well-being. Now, granted, there's nothing wrong with organizations and professional bodies that who's stated that their aim is to promote health and well-being. Nothing wrong with that. It's when there's this paternalistic attitude that is promoted with it. I'll be clear about that. And so as time went on with advances in medical science, there have been improved expectations for longevity and health status. So when we think about an earlier U.S. American history, folks did not live that long. They were generally unhealthy. There were a lot of uh, unhealthy human practices, right? However, with medical technologies, the longevity of folks were able to be extended. And so as time went on, you had declining fertility rates and rising leisure time and disposable income. But what really furthered this a bit more was the promotion and emphasis of individualism within Western societies. Now, going back to the discussion around fertility rates and rising leisure time. So, granted, while there were not a lot of folks having kids, folks were able to engage in activities that they were able to, that they really wanted to engage in. Okay. Now, that's not to say that they didn't have, they weren't portraying healthism per se, but what it's almost like, hold on, how can I say this nicely? Um, Whenever you had these folks engaging in, their leisure time, not having a lot of kids, um, there was this emphasis on the I. And within Western societies, individualism it's a characteristic. And when we think about the United States, for example, the main focus and the importance of independence, uh, well, hold on. The main focus is on the individual, the self. And what's valued in this particular society is independence. So as time went on, and when you think about when we think about, for example, uh, classism and capitalism, right? Capitalism will operate underneath classism, but uh, But what you saw over time was this commercialization of health. When we think about, for example, healthy eating, right? Organic foods, they being commercialized to folks through media outlets, as a way of saying this is the only way to be healthy. Um, Now, granted, with organic foods, with organic foods, there is the less chance of the inorganic pesticides, but you have organic pesticides on them as well. So when we think about the commercialization of health, um, it's this portrayal that health is health is really important, and it's something that you have to have. Um, and I recognize the concern in what I'm saying. And let me be clear. I'll be very clear um, about this particular point. Health is important. Taking care of yourself is important. And when there is monetary incentives um, to obtain that health, that is where the concerns lie. Are you being healthy? Are you engaging in this healthy lifestyle because you value your health? Are you engaging in this lifestyle due to extrinsic motivations? And so with the commercialization of health, you also saw the medicalization of all aspects of daily life. These include food choices and leisure activities. Something to make note, going back to the case vignettes that you saw in the beginning, right? Notice how there was a lot of paternalistic advice, paternalistic attitudes portrayed by the medical physicians. Now, granted, medical doctors and just doctors in general, right? Health service doctors. They are to provide resources for health. However, the concern lies is when there is this "I know what you need" type of attitude, paternalistic. Um, Instead of saying you don't know what's good for you, I know what's good for you, and I will always know what's good for you. Instead, there's no collaboration, and that's the concern. So, when we think about healthism, there are several assumptions. The first is that disease is no longer a misfortune. So, with this particular point, or this particular assumption, it argues that any type of disease can be preventable when we have research to show that that's not always the case. To some extent, you can reduce the possibilities of those disease developing, but you can't eliminate the whole possibility. And with that, it assumes that any of the health issues and diseases that a person has are at the person's fault. So basically, blaming that person, especially when there's the perceive that it's because they lacked motivation or self-discipline to take care of themselves properly. So when we look at the United States of America, right, more than a lot of individuals within this country have underlying health conditions. One of them being obesity, high blood pressure, cardiovascular diseases, cancers. And what we have seen in those who are not obese, those who don't have underlying or any other chronic diseases, right? There's the blaming of this person. And when we get to sizeism, we're going to talk about that a little bit more. Overall, it blames the individual for that physical disorder or psychological disorder. Another assumption, it overlooks other factors that can contribute to poor health. So, how many of you have heard of hypothyroidism? I'll give a pause. So, hypothyroidism is an organic physical disorder where you have the underregulation of the hypothyroid hypothyroid of the thyroid, and this can facilitate greater appetite, greater weight gain, greater amounts of sleep, and we know that those go hand in hand in weight gain, right? And even further, they mimic the symptoms of hypothyroidism mimic depression. So when we think about depression and when we think about obesity in particular, there might be some underlying physical disorders that contribute to those concerns. With healthism says it's all the individual's fault. When we think about weight gain, for certain people, it's genetic. Folks with certain genes they might have a higher metabolism than others. The point being of this slide is that underneath healthism, all of the blame is placed on the individual for any underlying physical disorder, any underlying and lack of engagement in a healthy lifestyle. So when we think about the impact, it's very, very great. And I do want to be clear, this is something that is very subtle and it's normalized within our society and even further within the medical field. And why it's important is because people go to medical doctors for a lot of things, right? And when you have medical doctors portraying or perpetrating, healthism, people are less likely to go back to the doctor. And because of that, whenever there is a medical concern that arises, people are less likely to go to the doctor because of fear for um, any fat shaming, um, any paternalistic behavior towards them. So overall, it's really important to be aware of your biases, and these are this is really important for folks that are going into helping professions. So I talked about that very broadly, but what are some specific things that can um, specific impacts of healthism? Well, first one provides for permission to engage in medical fat shaming. So when we think about fat shaming, right, um, especially within medicine, um, this moves the doctor, the helping professional, to suggest that, hey, maybe if you lost some more weight, you feel better. Um, and that might not be even the concern. So, and I'll be clear, while we have substantial research to document the impact of obesity on other areas of physical physiological reactions such as high blood pressure, um, there is stigma around being a person of size. Um, and I'll make note, with that particular stigma, that is perpetuated by medical doctors. So if a person's coming in with like maybe pains in their arm, a medical doctor is more likely to say, well, maybe if you lost a lot of weight, if you lost some weight, you wouldn't feel pain in your arm. When that's not, that may not even be associated with it. Um, so notice the paternalistic attitudes towards that person that um, that the doctor knows best. Provide support for medicalization of body size. So when we think about um, BMIs, right? When we think about a person's size, the average size is rather smaller than the quote unquote average size is smaller than the average person. From how I understand women's body size, the average body size is about, let's see, 10 to 12, if not a little bit bigger than that. And the healthy size is somewhere between that of a 5 and a 6, if not a little lower than that. So that is so if you were outside that range, technically you are considered obese, and even further unhealthy. So when we think about that, right, that doesn't fit the reality of the US American woman. Medicalization and duty to treat. So there's this belief that folks who are obese, they don't know what's best for themselves, and they have to be protected from their unhealthy appetites and behaviors by healthcare providers. A study actually found that 90% of residents in internal medicine agreed that obesity is a chronic disease that must be addressed by physicians. Oops. So let's pause right here. So granted, obesity is a rather chronic physical disorder. Now, let me be clear. The way that we have addressed and approached obesity is not, uh, how can I say this? It's not been conducive. So instead of looking at it as a medical issue, a majority of the times it's seen upon as a medical issue that only medical doctors can address. That's not true. Um, if anything, obesity might be considered that of a public health issue, um, and even further, an issue around stigma. And so when we get to sizeism, I'll talk about that a little bit more. But overall with healthism, it's this, it's a more subtle, I say more subtle. It does definitely has systemic interpersonal and personal levels. And it's one that is more normalized and one that is more accepted within our society. So now I'm going to switch over into the sizeism lecture. So go here. All right. So switching over into the size status, okay? So now we're going to focus not only on people who are a bigger size, but people who are a smaller size, those who would be classified as skinny. So I'm going to show you a word up on the screen. Fat. 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 So this word in particular has facilitated a lot of negative reactions. And we're going to talk about why that is. And I'll be very honest. For me, this is a word that still carries some difficult emotions for me. Granted that this word has been used as a stigmatizing characteristic for people who are um, obese or even heavier or of size. So when we think about, but let me go back. When we think about the word fat, right? Immediately our mind goes to something that's bad. When we think about, when we maybe on another hand, instead of seeing it as like some kind of problem, might just be a descriptor. So I have some key terms up here. When we think about fat studies, right? This is the interdisciplinary field of scholarship that is marked by this consistent, aggressive critique of negative assumptions, stereotypes, and stigmatized placed on fat and the fat body. So when we think about fat, right, there's this reclaiming of the term as an embodied location in which to theorize for social change. Another term, Goldilocks rule. So this is the preference to aesthetics, health, and suitability for size. So when we go back to the tale of Goldilocks, right? She broke into their house. Yes, she broke into their house. And she ate their porridge. She slept in their bed. She sat in their chairs, right? A lot of damage. She robbed them. I'll be very frank about that. And where she found the bed that was just right, the porridge that was just right. So it's, when you look at those extremes, right? For example, the bed was too big. She didn't like it. The bed was too small. She didn't like it. And she found the medium bed, right? And it was just right for her. When we think about that particular scenario, it's finding what was just right. And when we think about the Goldilocks rule, stemming from that story, aesthetics, health, and size that are just right. Having the hourglass figure, not too big, but not too small either. Not too thick, but not thin either. Just the right amount of thick. Now, when we think about size discrimination, this is the allocation of resources and goods based upon one's size. And I'll be frank, not only do people who have a fat body are discriminated, those who have a thin body are also discriminated against. So going to sizeism, right? This is discrimination against individuals based on body weight and shape. So people who are obese and people who are thin. Like I mentioned with the Goldilocks rule, preference for those who are thin and obese, right? When we think about someone who is just right, I moved too quickly. I'm thinking about someone who is just right, not necessarily someone who is on the extreme. So when we think about sizeism in history, right? In the beginning, it was a sign of health and wealth, right? The more money you had and the more resources you had, that meant you were that was a sign of wealth, right? Being bigger was a sign of wealth because that meant you have more resources, more food. And this was something particularly notable about in royals and people who had, were rich. However, with the changing US economy, right, when you had the Great Depression hit, you had people that were losing resources. And it wasn't until, uh, and let me back up here. Um, with the availability of food, right, not a lot of people were able to get food. And so when the US economy changed, right, when you had the Great Depression, what you noticed was that there was this loss of prestige for people who were considered to be fat, and instead, people who were thin, people who were, like thick, um, and when I mean thick, I'm talking about small thick. I'm not talking about thick thick. Um, Kim Kardashian thick. How about that? Or Beyonce thick. Um, those folks who were not that size were seen as signs of prestige. So if you're slender, you were the in group. And this is often reinforced by media and by even further science. Now, granted, with with medical research, right, and physical health research, I'm not saying that being slender is something a person should strive for. Being healthy is really important. Um, and a lot of people miss that point with health research and health science. Uh, the aim is to be healthy, not slender. And we also see this reinforcement within the media, right? In magazines, in news outlets, and so forth and so on. Now, if you haven't seen these two folks, I'm just going to provide you with some context. So Lizzo's one of my favorite people, and she's also a woman of size, and she's been very adamant about loving her body and promoting body positivity um, amongst different folks, right? Now, if I remember her name, Jillian Michaels. Um, she went on the air to talk about Lizzo's size, and she mentioned that it's great that she's doing this, but it's not going to be great when she gets diabetes. So, granted, people took to social media and were like, "What the hell?" And so when we think about that particular comment, that was a microaggression. Because it communicates this message that because Lizzo's a person of size, she's definitely she's definitely going to get diabetes. The probability of her getting diabetes would be rather high. So overall, when we think about the impact of sizeism, it's one that is rather insidious, and it's one that is readily accepted. So with these negative attitudes, right, it's reinforced by media. And a lot of that comes from confirmation bias. So if you haven't been to Psych 102, confirmation bias is basically where you seek out information that confirms your belief, not challenges it. So when we think about what maintains these negative attitudes, stereotypes of people who are obese and thin, there are rather negative stereotypes about this particular group, right? When we think about people who are obese, they tend to be portrayed as lazy, as a problem to be fixed. Same thing for something as a person who is thin is that they are purposely doing it. They're purposely trying to be thin. There's also aesthetic preferences for thin bodies. When we think about models, right? When we look at Victoria's Secret, From my, as long as I've been alive, I have not seen a quote unquote plus size model walk down the runway. And what is considered to be plus size is just a little less than that of thick. And even further, when we think about body size, right? When we go back to healthism, and because sizeism is rooted in healthism, it's this idea that you're responsible for your body size and for your health. So we're going to look at some studies of explicit and implicit attitudes. So when we think about explicit attitudes, this is basically asking people if they agree. So this is more explicit. And with these explicit attitude studies, there's the tendency to underestimate the extent of sizeism. So people have turned to implicit attitude studies that really bypass that critical thinking. And so one example of implicit attitude studies is the IAT, the implicit association test. So it shows images of people who are fat or thin and then asks them to assign a particular characteristic. So depending on if this person is, if they show a person who's fat and a person assigns motivated, lazy, good, or bad. So what have we learned from implicit studies, especially amongst healthcare professionals? Stereotypes of obese people affect healthcare professionals' attitudes towards obese patients. That's a big deal. So going to specific findings, obesity experts associate fat people with being bad, being lazy, being stupid, and worthless. Physicians and nutritionists associate fat people, I found a typo, associate fat people with being lazy or having low motivation. Personal trainers and PE teachers, one study found that they show high levels of implicit sizeism. So when we think about those who are working in the healthcare field that are working to address obese studies, or not obese studies, but obesity, there's a demonstration of implicit bias. And this is really important when we talk about the impact of that. Now, explicit studies have found that dietitians agreed that obese people are unattractive, insecure, slow, and inactive, with low endurance and self-esteem and poor self-control. Amongst physicians, they agreed that fat patients are often non-compliant, less self-disciplined, and worse at taking care of themselves than other patients. Now, psychology is not exempt from these studies either. Psychologists, they expected more mental health problems with fat clients that would be more difficult to address. So let me go back here. So when we think about these implicit and explicit attitudes, remember that these attitudes facilitate how we interact with that individual. So it's also important to note that people with marginalized identities recognize this implicit bias. So folks who are fat, folks who are thin, are also likely to recognize these signs, recognize this treatment. And something that I want to point out, the psychological problems that are concerns that people who are fat and thin face, are more so around stigma, right? Now, when I'm talking about, and when I'm talking about that, I'm talking about depression. I'm talking about anxiety. I'm talking about low self-esteem, right? When you look at the media and when you hear professionals who are supposed to help you say rather negative things or negative things about your body, that can be rather debilitating and rather disheartening. And so granted, there might be some underlying physical disorder that mimics depression and anxiety, but we also have to take in consideration that it's not always about that. It's not always about the biological. It can be about the psychological and the social cultural, right? So with that stigma exacerbates that it exacerbates these uh, mental health concerns. Even further, lower self-esteem and poor self-control. Um, so stigma is stigma should be considered when we think about sizeism and healthism. So what do these findings mean? So overall, these findings suggest that it's more so acceptable to express sizes attitudes, especially amongst providers, and that it's okay for them to say that or express these attitudes towards their patients. Once again, going into that paternalistic attitude. I know what's best for you. Implicit attitudes may leak when we think about microaggressions. And some of these include a doctor's reluctance to touch an obese patient, or shaking their head and making noises while weighing patients. So if a patient steps on a scale, right, and a doctor's like, ooh, that's a microaggression, right? Because it's like, well, dang, man, like I'm learning, I'm getting my weight, but you don't have to comment on it. Um, that's something else we have to think about too. These findings are rather stressful, and they can cause a delay in seeking healthcare. If I'm going to go to a doctor and they deliver a microaggression towards me because of my size, then I'm less likely to go to a doctor again. And oftentimes, this can result in misdiagnosis, and even further unethical and a form of malpractice. So, sizeism and stress, right? What does this mean for people who are fat and people who are thin? Um, there's the perceived unfairness model. Um, so, whenever we experience discrimination or prejudice, or observe it on another person who's in our group, that can set off a whole bunch of psychological and physiological reactions. One that has direct effects on your heart and lung functioning. And we know that stress has direct and indirect effects. So when a person, so now this is where we get a little bit physiological. When a person experiences stress, right, the body goes through a physiological reaction. Now, under a certain amount of time, stress is okay. Stress is to help the person adapt to that stressor. When the stress becomes chronic and the time that the stress is occurring is longer, this can suppress the immune system, even allowing the person to become more sicker. There's also cognitive impairment. When there's chronic stress, there's there's disrupted attention, and even lower critical thinking skills. When we think about intersectionality, right, what does it mean to have these different identities and also be described as fat and thin? It's very different. So when we think about, quote unquote, a big Black man compared to that of a big white man, people have different reactions to, or people have a stronger and more negative reactions, or excuse me, difficult reactions to a big Black man, and they're perceived as dangerous, right? So that's just an example, but to think about intersectionality, right? What does that mean for people whose identities are rather different and yet described as fat or thin? So with sizeism, not only are there physiological reactions, there's also internal reactions where there's this internalization of the thin ideal, which can facilitate self-blaming and even vulnerability to social identity. So indirects of sizeism on health, if we have substantial evidence to show that obese folks have received disrespectful treatment in the healthcare system. And this results in lower trust in physician advice and reluctance to make return visits. Even further, delay in seeking healthcare. So some reasons that have often been cited, weight gain since previous visit, not wanting to be weighed, and knowing that they'd be told to lose weight. And with this delay, it's been linked to higher mortality and poorer self-rated health. Sizeism even further can lead to weight gain and avoidance of exercise. Now, some direct effects on health. So we know that there are weight-related barriers to seeking healthcare treatment, right? Um, Difficult to access doctor's office, might be too many stairs. So think about ableism as well. So this is where ableism and sizeism kind of intersect. Furniture, clothing, and equipment may not be large enough for that individual. Denied healthcare services because of their weight. Negative attitudes of providers. They may spend less time, display less patience, and provide less health education to these patients than to their other patients. They may not allow for enough time for patient to ask questions or describe their symptoms, and it often can lead to misdiagnosis or patient misunderstanding treatment recommendations. Even further, there's the assumption that obese patients would not follow certain recommendations. And I also want to make note, there's exclusion of obese folks from medical research, and also thin folks from medical research. And when I mean thin, I'm talking about someone who is not the average, quote unquote, average thin. Also, we also have to think about financial resources in regards to treatment. So there are a lot of factors that go into seeking treatment, and looking at these particular effects of sizeism on health. I'm curious if you had if you had learned about these or if you were aware of these. So what can we do? When we think about healthism and sizeism, these go hand in hand. First step, something that I always advocate is know your stuff. Know your biases and explore them, especially these biases with people who are thin and people who are obese. Explore where some of that comes from. The next step is challenging these assumptions about health status and size, and even further including spaces for people who are thin and people who are obese, giving them space to center their voice, and have their voices heard. And then lastly, listen. Um, don't talk over another person who is obese or thin when they're talking about their experiences. Don't say, well, maybe it's because of this. Just listen. Much like being an ally um, for Black and Indigenous people of color, being an advocate for people with disabilities, uh, and so forth and so on. Be an advocate for people who are fat and who are thin. And the reason why that's important, is because their voices have not been the center. The voices that have been at the center of their lives, are medical professionals who think that they know more than that client, more than that patient, and also um, people who are quote unquote the average size have been the center of health. Um, their voices have been the center. So overall, we talked about healthism and sizeism in this lecture, and I'm very curious to hear your reactions about these particular oppressions, and even further, what you not only what you've learned, but also what your next steps are going to be. And that's it.